Thank you so much for this wonderful introduction. It's truly a great honor for me to be here today. I have to thank my friend Mariam and all the Pharmalys team for the invitation. You have introduced me as a clinician, professor of internal medicine. I just would like to add that I'm passionate about clinical trials and especially passionate about advocating for advancing research on non-communicable diseases in Africa. You probably know that addressing the burden of non-communicable disease to improve healthcare outcomes in Africa is a very long journey. It's crucial to recognize the critical importance of clinical research. You all know that infectious diseases trials have traditionally dominated the research landscape on the continent, but the time has come now to shift our focus towards non-communicable diseases because they pose a real threat, a more and more significant threat to the well-being of our populations. The prevalence of non-communicable diseases such as diabetes, cardiovascular disease, cancer is on the rise everywhere around the world, but the most important increase is predicted to occur in Africa. NCDs are already the leading cause of morbidity and mortality in low and middle income countries, and nearly 3/4 of all NCD-related deaths occur in Africa. However, there are still major gaps in NCD research in Africa. The actual burden of those NCDs is not really known because available data are mainly driven from extrapolations and estimations from neighboring countries. Complications associated to these NCDs are rarely studied, and research on healthcare interventions are very scarce, and intervention pharmacological research is nearly almost absent. According to a study which was published in Circulation, Cardiovascular Quality and Outcomes, despite being home to 1.4 million people, Africa accounts for just 2% of cardiology clinical trials. And this study that I just cited highlights the huge gap between Africa's share of the global burden of cardiovascular disease and the scarce participation in cardiology clinical trials. Overall, randomized controlled trials are underrepresented in Africa. I have recently conducted a situation analysis on diabetes and cardiovascular disease in Africa, and out of the 391 included trials in my study, only 2.3% reported including Africa continent exclusively. Reasons are cited for the scarcity of clinical trials in Africa are mainly the lack of expertise. We were discussing about this, Veronique, right? Infrastructure and resources that are not adequate to fully implement high-quality clinical trials. And we have to admit that regulation in our countries often do not meet international standards, such as the Helsinki Declaration or regulations of industrialized countries like the United States or Canada or Europe. And conducting research in such settings is then considered as a risk to the safety of research participants and the integrity of scientific results. On the other hand, the scarcity of research also has implications such as inapplicability of some findings in African settings. The results of Western clinical trials are not necessarily valid for African populations. Thus, lack of ability to optimize interventions. And this is due to the fact that African populations have a high degree of genetic variability, which translates into variability in the prevalence and frequency of diseases in different ethnic groups. This variability is also influenced by other social and environmental factors that has to be taken into consideration. I would like to give you an example as a diabetologist. There is an unusual presentation of diabetes called ketosis-prone type 2 diabetes that do not fit the traditional categories that have been defined by the American Diabetes Association or the International Diabetes Federation. And this presentation has been observed only in African population. But there is no specific management of this ketosis-prone type 2 diabetes because there are not clinical trials dedicated to that specific presentation of diabetes. So we take into account recommendations and guidelines that come from Europe or America. This is what we use to manage our patients. And for all these reasons, the NCDs present a pressing need for innovative research strategies tailored to our unique challenges and also our research constraints. To bring more of these clinical trials to Africa and drive forward progress in combating non-communicable diseases, we must take concerted action on multiple areas. The first one would be to build research capacity. And I'm very delighted to be here. Congratulations again, Mariam, for this initiative. We need to empower, we definitely need to empower the young African researchers through education, through training and mentorship programs like this one. It's important to increase the number of clinical research organizations in Africa who know the special context we are facing. To support those clinical research organizations in Africa and to establish research academies like this one, PACE, the first one. Congratulations again. Secondly, we need to enhance the research infrastructure. We need to invest in state-of-the-art research activities, facilities, laboratories, and technology. This is essential to conduct high-quality clinical trials on non-communicable diseases. And we need to collaborate with global partners and leverage emerging technologies to bridge the infrastructure gap and facilitate the cutting-edge research. We have to promote multidisciplinary collaboration, fostering collaboration between healthcare professionals, researchers, industry stakeholders, and community leaders is key to advance this research on NCDs. And I think that by leveraging diverse expertise and perspective, we can drive innovation, improve patient outcomes, and address the complex challenges posed by these diseases. And finally, we need to advocate for policy support. Engaging policymakers at the national and international levels is crucial to create an enabling environment for clinical research in Africa. We need to advocate for policies that protect intellectual property and rights, promote ethical standards, because this is essential to attract investment and foster a conducive research ecosystem. To conclude, I would like to say that the path to bringing more clinical trials on NCDs to Africa is paved with dedication, collaboration, and a steadfast commitment to improving the health and well-being of our communities. And as we gather today to celebrate the achievements of these graduates in clinical research activities, clinical research excellence, I would like to reaffirm our collective resolve to champion the cause of NCDs in Africa and pave the way for a healthier and more vibrant future for generations to come. Once again, I would like to congratulate you. And if you allow me, maybe I could enroll on the next cohort, if I'm not too old for that. Thank you very much.